Hello, everyone, and a very warm welcome back to the Chatterbox English channel, where we practice English for real life. I'm Elena.
And I'm Pavel. It's great to be here. Today, we're going to a place that is very important, especially when you're feeling unwell or in a new country. We're talking about a visit to the pharmacy or the chemist's.
That's exactly right. Knowing how to explain what you need and understand the instructions is not just about language, it's about your health and safety. So this is a very useful topic.
It definitely is. You know, Elena, I have to admit, I sometimes feel a bit nervous in a pharmacy abroad. I worry I won't find the right thing or I'll misunderstand the dosage.
That's a very common feeling. But with a few key phrases and knowing what to expect, you can feel much more confident. So, let's start from the very beginning. Pavel, you don't look your best today. Are you feeling okay?
Not really. I think I'm coming down with a cold. It started yesterday with just a little tickle in my throat, but now my throat is quite sore. It's painful to swallow, and I've been sneezing almost nonstop.
Oh dear, that sounds unpleasant. Any other symptoms? A headache? Feeling tired?
Yes, actually. I have a dull headache here at my temples, and I do feel more tired than usual. No fever, though, I checked.
Okay, good to know. So you have a sore throat, sneezing, a headache, and fatigue. That's a clear set of symptoms. Now, the first step at the pharmacy is often to look for what you need yourself. Medicines are usually in aisles with signs. What might you be looking for?
Well, for the sore throat, maybe some lozenges or a throat spray. For the headache, painkillers. And for the cold, maybe something general like vitamin C or cold medicine.
Good thinking. Lozenges, throat spray, painkillers, cold and flu medicine. Those are perfect keywords. But sometimes you can't find what you need, or you want advice. That's when you talk to the pharmacist, the healthcare professional.
Right. How do I start that conversation? Do I just list my symptoms?
You can. Approach the counter and say, "Excuse me, I wonder if you could give me some advice." That's a polite way to start. Then describe how you feel. Try it. Describe your symptoms to me as if I'm the pharmacist.
Okay. Excuse me, I wonder if you could give me some advice. I think I have a cold. I have a very sore throat. I'm sneezing a lot, and I have a bit of a headache.
Perfect. Clear and polite. Now, the pharmacist might ask you some questions. They might say, "Do you have a fever?" Or, "Is it a dry cough or a productive one?" Meaning, is there mucus?
Ah, productive cough. That's a new phrase. I would say no fever, and my cough is dry, just a tickle.
Good. Now, let's talk about different types of medicine. For your symptoms, the pharmacist might suggest a few options. They might say, "For the sore throat, I recommend these lozenges. They have a mild anesthetic to numb the pain." Or a throat spray might work faster.
Anesthetic. That means it numbs the feeling. And what about the headache and general cold?
They might suggest you could take a paracetamol or ibuprofen for the headache and any aches. And for the cold symptoms, this multi-symptom cold relief capsule might help. But they will always tell you, make sure you don't take two medicines that contain the same active ingredient. That's very important to avoid overdose.
Right, so I need to read the labels carefully. Active ingredient, like paracetamol.
Exactly. Now, a very important question they will ask is, do you have any allergies or are you taking any other medication? This is for your safety. You must answer honestly.
So I should say, no, no allergies. Or, no, I'm not on any other medication. What if I am taking something?
Then you say, yes, I am currently taking name of medicine. Always tell the pharmacist. Now, let's move to a different situation. What if you have a prescription from a doctor?
That seems easier. I just give them the paper.
Almost. You go to the prescription counter. You can say, "Hello, I'd like to drop off this prescription, please." They might ask, "Is this your first time using this pharmacy?" or for your date of birth for their records. Later, to collect it, you say, "I'm here to pick up a prescription for your name."
And when they hand me the medicine, the most important part is the instructions.
Absolutely. Don't be shy to ask. You can say, "Could you go over the instructions with me, please?" They will explain the dosage. For example, take 1 capsule twice a day after food. They might warn about side effects like drowsiness. Always ask, are there any side effects I should be aware of? And should I avoid alcohol or driving?
What if I need something simpler, like plasters for a cut or sunscreen?
Then you just ask, "Where can I find the plasters, please?" Or, "Do you have any high-factor sunscreen?" That's much more straightforward. Now, let's do a long combined role play. I'll be the pharmacist, you come in with your cold symptoms, and you also need to pick up a prescription for your friend.
Okay. Excuse me, hello. 2 things, please. First, I'm not feeling well. I have a sore throat, a dry cough, and a headache. Could you recommend something?
I'm sorry to hear that. Any fever? And are you taking any other medication?
No fever, and no other medication.
All right. For the throat, these lozenges are very soothing. For the headache and general aches, I suggest paracetamol. Here's a pack. Remember, don't take more than 8 in 24 hours and drink plenty of fluids.
Thank you. And my second thing, I'm here to pick up a prescription for Anya Kovac.
Of course. Let me check. Yes, here it is. This is a course of antibiotics. It's very important to finish the entire course, even if you feel better. Take 1 tablet 3 times a day with food. It can cause an upset stomach, so taking it with a meal helps.
Okay, thank you for explaining. Could you also point me to the plasters?
Aisle 3, on your left, near the bottom.
Perfect. Thank you for your help.
Wonderful, Pavel. You handled both situations very well. You were clear, polite, and asked good questions.
It feels less daunting when you practice the conversation. Let's recap the golden rules. 1, describe symptoms clearly. 2, mention allergies or other medications. 3, always ask about instructions and side effects if unsure.
Exactly. Your health is the priority. Being a good communicator at the pharmacy is a part of taking care of yourself. Remember these phrases, and you'll be prepared.
Thank you, Elena. I think I need to go and have a hot tea with one of those lozenges now.
That sounds like an excellent idea. Feel better soon, and thank you all for listening. We hope you feel more confident for your next pharmacy visit.
Take care, and we'll see you in the next conversation on Chatterbox English.